If you've been noticing that your stream of urine is getting weaker, you're definitely not alone, and there's usually a good explanation for it. In men, one of the most common reasons is the gradual enlargement of the prostate. The prostate is a small, walnut-shaped gland sitting just below the bladder, and its job is to produce most of the fluid in semen. From around the age of 35, it begins to grow slowly. As it enlarges, it presses on the urethra, the tube that carries urine out of the body, which runs right through the middle of the prostate. This pressure narrows the passage and makes it harder for urine to flow freely. As a result, men often find that it takes longer to get started, the stream becomes weaker or stops and starts, and there may be dribbling at the end or a feeling that the bladder isn't emptying completely. These are known as voiding symptoms because they happen during the act of urinating. An enlarged prostate can also create higher pressure inside the bladder as it tries to push urine past the obstruction. Over time, this strain can irritate the nerves of the bladder, creating new symptoms such as a sudden urge to rush to the toilet, leaking if you can't get there quickly enough, needing to urinate more often, and waking up several times at night. These are called storage symptoms because they occur while the bladder is filling rather than when you're emptying it. Although prostate enlargement is the most common cause of these issues, it's not the only one. Doctors often say the bladder is a blind witness because the symptoms alone don't reveal what's actually causing the problem. For example, the bladder muscle itself can sometimes become weak, a condition called detrusor failure. In this situation, the bladder simply doesn't have the strength to push urine out properly, even though nothing is physically blocking the flow. On the other hand, the urethra may become narrowed for other reasons, such as a urethral stricture, which is a tight, narrow segment of the urinary channel. When urine has to force its way through a narrow tube like this, the stream becomes slow and weak, much like trying to pour water through a hose that someone is pinching at the end. Storage symptoms can also be caused by bladder overactivity, where the bladder becomes overly sensitive and gives you an urgent need to urinate more often than normal. This is especially common in women and doesn't always have a clear underlying cause. Sometimes certain drinks like coffee, fizzy drinks, or acidic juices make things worse, and many people benefit from cutting back on these, drinking less fluid in general, practicing bladder training, or doing pelvic floor exercises. To understand what's actually happening, urologists rely on a number of tests. During an office visit, they examine the prostate to get a sense of its size and texture. If it feels unusually firm or irregular, they may order a PSA blood test and an MRI scan to look more closely. Another simple but valuable test is a flow study, where you urinate into a special device that measures how fast the urine comes out, how much you pass, and how long it takes. Afterwards, a quick bladder scan shows whether you emptied completely. These measurements can offer important clues. For instance, most men with a peak flow below 10 milliliters per second have some sort of blockage, often due to an enlarged prostate. Flow values in the 10 to 12 range are less clear, while readings above 12 generally suggest that the flow is not being obstructed. In some cases, the urologist may use a small camera to look inside the urethra and prostate to check whether the prostate is squeezing the urine channel from within or whether a stricture is to blame. When the anatomy alone doesn't fully explain the symptoms, a more detailed test called urodynamics may be needed. This test measures the pressures inside the bladder and the abdomen with tiny pressure-sensing catheters, one in the bladder and one in the back passage. By comparing these pressures, doctors can see how hard the bladder muscle is working and how it behaves both while filling and emptying. A high bladder pressure combined with a poor flow points strongly to an obstruction, while bursts of high pressure during the filling phase indicate an overactive bladder. With these tests, urologists can figure out the true cause of your symptoms and offer the right treatments. In the next video, we'll explore the options for improving both storage and voiding symptoms in much more detail. I hope you've enjoyed this explanation and found it helpful.